this case that we presented today, a 52-year-old gentleman presenting with metastatic disease at diagnosis, after surgery, having progressive disease, starting on cabozantinib, and seeing a dose response, seeing a partial response with that first scan. This is, to me, this is a successful story. This is a case of somebody that's likely to respond for a long period of time on this drug. And this is a patient where, even though we went from 60 milligrams down to 40 milligrams, I know that's an active dose. I can maintain that patient for a long period of time. It's also a patient I know is going to have second and probably third or fourth line therapies available to them in the future. So I haven't burned any bridges by starting with a drug like this. I've bought them time, I've gotten them a remission. I've got toxicities we can manage, we can titrate with interruptions and dose modifications. So to me, this is a successful kidney cancer case. Now, we still got work to do in the field. We got to figure out how to get cases like this from a partial response to a complete response. We got to understand more about this biology. This disease went from being a VEGF-targeted disease to being a multi-targeted disease now with BET and AXL. We've got immunotherapy, on the other hand, effective in this therapy, but not in everybody, in this cancer, but not in everybody. We've got to figure out how to combine some of these strategies, how to combine them in either sequence or combinations. But ultimately, we've got more tools than ever in this disease. Kidney cancer, to me, is probably one of our most promising diseases now to treat it. 15 years ago, this was a disease nobody ever wanted to see. And now I've got patients that have 15 years of metastatic disease. So you can feel good about treating these patients. You can feel good about using these agents in the frontline setting. You're going to have to work on it. But over time, your patients are going to get comfortable with this. And I think you'll be satisfied like me with the progress we've made.